That constant clearing of your throat. That sticky, stubborn feeling that shows up every single morning before you've even said a word. That's something lodged in your throat that no amount of coughing, swallowing, or sipping water seems to move. If you've been living with this, I want you to stay with me, because what I'm about to share could save you years of frustration, unnecessary medications, and most importantly, that quiet resignation that so many of my patients carry when they walk through my door. I'm Dr. Leonard Brooks, and for over 2 decades, I've specialized in treating older adults, men and women who come to me tired, frustrated, and often feeling misunderstood by a medical system that hasn't taken the time to truly listen. My job isn't just to write prescriptions. My job is to translate what your body is trying to tell you when nobody else is paying attention. Now, before we go any further, I want to address the phrase I hear more than almost any other in my practice. Doc, I figured it's just my age. I need to look you in the eye right now and tell you something clearly. Chronic phlegm is not normal. It may be common, especially as we get older, but common and normal are not the same thing. Common means it happens a lot. Normal would mean it's supposed to happen, and it's not. Let me tell you about a patient of mine. Eleanor, 74 years old. She came in carrying a folder stuffed with old prescriptions, cough syrups, throat sprays, herbal remedies, antihistamines. Each one helped for a few days. Then the phlegm came back. She had started avoiding conversations at family dinners. She would sit quietly at church, clearing her throat in embarrassment. She slept poorly because lying down made the feeling worse. When I asked her what other doctors had told her, she gave me a sad smile and said, "They said it comes with age." That was the moment I knew exactly what had been missed. So here's what I want you to do right now. Stop thinking of phlegm as your enemy. Start thinking of it as a messenger. Your body does not make mistakes. Phlegm doesn't appear randomly. It appears because your body is defending itself. And once you understand what it's defending against, you can actually solve it. Not mask it, solve it. Let me explain the biology in a way you'll never forget. Picture your airway like a freshly cleaned hospital corridor. Everything is moist, flexible, and moving. Now imagine that corridor is lined with a thin, nearly invisible film. That film is mucus. And mucus is not dirt. Mucus is protection. Its entire job is to trap dust, bacteria, viruses, and pollutants before they reach your lungs. To keep that corridor clean, your body has millions of tiny hair-like structures called cilia. They move in perfect coordination, sweeping that mucus upward toward your throat, where you swallow it without even noticing. Your stomach handles the rest. When everything is working, you feel nothing. The problem begins when one of two things happens. Either too much mucus is produced, or the mucus becomes thick, sticky, and slow. Think of it like a traffic jam on the highway. It doesn't matter if there are too many cars or if the cars are moving too slowly. Either way, traffic stops. That's what you're feeling when phlegm builds up in your throat. Your system isn't broken, it's backed up. Now let's talk about where this is really coming from, because this is where most people, and honestly many healthcare providers, get it wrong. Everyone assumes phlegm starts in the lungs. Chest infection, bronchitis, something in the airways. But after more than 20 years of seeing this problem repeat itself in older patients, I can tell you with clinical confidence that in the vast majority of cases, the phlegm is not coming from the lungs. It's coming from above and below at the same time. The first hidden cause is what I call silent reflux, and it may be the most misunderstood condition I treat in seniors. When most people hear the word reflux, they think heartburn, that burning in the chest, the fire after a big meal. But there's another form of reflux that doesn't burn at all. It doesn't hurt, it doesn't announce itself, but it irritates your throat every single day. Here's how to picture it. Imagine your throat as a very delicate tissue, similar to the inside of your cheek. Now imagine that every night while you sleep, a fine acidic mist rises from your stomach. Not a flood, not a burning surge, a mist. That mist touches your throat, your voice box, your vocal cords. And what does your body do when something irritates it constantly? It protects itself. And how does the throat protect itself? By producing more mucus, thicker mucus, stickier mucus. That phlegm you feel every morning isn't a disease, it's a shield. Here's what makes this so tricky. Most people with silent reflux have no chest pain whatsoever. What they have is a chronic need to clear their throat, a rough or hoarse voice in the morning, a sensation of something stuck, a dry cough that's worse when lying down, a feeling of a lump that never quite goes away, and a bitter or stale taste first thing in the morning. If you just recognized yourself in several of those, that is not a coincidence. One of my patients, a gentleman named Robert, 80 years old, said something I'll never forget. He told me, "Dr. Brooks, I don't feel anything in my chest, but my throat never gets a rest." That was the moment I knew exactly what we were dealing with. When we corrected the real source of his problem, his body stopped needing to produce that shield, and the phlegm, slowly but surely, went away. The second hidden cause is post-nasal drip, and it's one of the most overlooked contributors to chronic phlegm in older adults. Picture a faucet with a slow, steady drip, not gushing, just dripping all day long. That drip falls directly onto the back of your throat, irritating it constantly, triggering more mucus as a response. The important thing to understand here is that you don't always have a stuffy nose. You may have no visible congestion, no sneezing, nothing that looks like allergies, just phlegm. The causes are often hiding in your home. Dust, dust mites, humidity changes, dry air, air fresheners, cleaning products, even certain fabrics. This is why so many of my patients say, "I'm not sick, I don't have a cold, but I have this stuff in my throat all the time." Exactly right. Because the trigger isn't an infection. It's a constant, low-level irritant. The third hidden cause is something almost everyone overlooks, and it may be the simplest of all: dehydration. Not dramatic, obvious dehydration, the quiet kind that creeps up on older adults without warning. As we age, our sense of thirst decreases. Many common medications pull fluid from the body. Indoor heating and air conditioning dry out the air we breathe. And when your body doesn't have enough water, it prioritizes vital organs. The mucous membranes get less. The result is mucus that becomes thick, dense, and nearly impossible to move. Not because there's more of it, but because it can't flow. Your body isn't producing extra phlegm. It's producing phlegm that's too thick to clear on its own. I want you to hold on to this idea. The phlegm is not the problem. The phlegm is the solution your body invented to deal with a problem. If you just try to suppress it without understanding why it's there, it will come back every single time. But if you correct the underlying cause, the body no longer needs to defend itself, and the phlegm stops on its own. So let's talk about what to actually do. This is the approach I use with my own patients, and it works because it works with your body's design, not against it. Start with hydration, but not the way you've been told. Drinking more water matters, but how you drink, when you drink, and the temperature of what you drink matters just as much. Mucus is mostly water. When your body is even mildly dehydrated, that mucus thickens. The fix is consistent, steady fluid intake throughout the day. Not one large glass and then nothing for hours. Small amounts regularly. And here's the key most people miss: warm or room temperature liquids. Warm fluids thin the mucus and relax the airways. Cold fluids do the opposite. Start your morning with a glass of warm water. Mid-morning, a gentle herbal tea. Afternoon, another warm drink. Before bed, something soothing. This isn't complicated. This is giving your body the internal environment it needs to clean itself. The second thing to address is the air around you, especially while you sleep. You can drink perfectly all day and still wake up with a throat full of phlegm if your bedroom air is too dry. At night, your mouth tends to open, your breathing slows, and dry air pulls moisture directly from your mucous membranes. By morning, that mucus is thick and heavy. Adding a little humidity to your sleeping environment, whether through a humidifier or simply being mindful of your room conditions, allows the mucosa to stay flexible and functional so it can move and clear naturally. Third, help your throat clear gently, not forcefully. This is where many people make their symptoms worse without realizing it. Aggressive throat clearing, hard coughing, forcing things, all of that creates inflammation. Every time you clear your throat forcefully, you're striking your vocal cords. That perpetuates the irritation and keeps the cycle going. Instead, gargle gently with warm salt water. It reduces local inflammation and helps loosen mucus using basic physics, nothing fancy. A small amount of raw honey can coat and calm the mucosa temporarily, giving your body a chance to settle while the underlying cause is being corrected. If you feel drainage coming from the nose, gentle saline nasal rinses can help clear the source without the rebound effect that decongestant sprays cause. Fourth, and this one is critical, stop eating close to bedtime. When you lie down with a full stomach, gravity stops working in your favor. Stomach contents press upward. That acidic mist I described earlier, that silent reflux, is far more likely to reach your throat when you're horizontal right after a meal. I tell every one of my patients this. Give yourself at least 3 hours between your last meal and the time you go to bed. That single change alone reduces nighttime throat irritation dramatically for many people. Elevating the head of your bed slightly, and I mean the entire upper portion of the bed, not just adding pillows, also uses gravity to keep things where they belong. Now, I want to warn you about a few things that are commonly done with good intentions, but make this problem worse. Using over-the-counter antihistamines without a clear indication tends to dry the mucous membranes and actually thickens the mucus, making it harder to clear. Nasal sprays provide temporary relief, but often create a rebound effect that worsens congestion over time. And as I mentioned, repeated forceful throat clearing is one of the most common things my patients do that keeps them stuck in this cycle. If you feel the urge, swallow slowly or take a small sip of warm liquid. Your vocal cords will thank you. One important note before I close. Everything I've described today is designed to address the most common causes of chronic phlegm in otherwise healthy older adults. But I have to be clear with you. If your symptoms have lasted more than a few weeks without any improvement, if you see any blood, if you have difficulty breathing, fever, unexplained weight loss, or significant pain, please do not wait. Those are signals that need a professional evaluation promptly. Listening to your body also means knowing when to call for help. Here is what I want to leave you with today. Your body is not failing you. Your body is communicating with you. That phlegm in your throat every morning is not a punishment. It is not the inevitable tax of getting older. It is your body's intelligent response to something that is quietly irritating it day after day. When you understand that message and give your body the environment it needs to stop defending itself, it responds, sometimes faster than you'd expect. You don't have to overhaul your entire life overnight. Sometimes the shift begins with something as simple as drinking a warm glass of water first thing in the morning, or waiting 3 hours after dinner before lying down, or sleeping with a little more humidity in the room. Small corrections, consistent habits, respect for what your body is trying to tell you. I've watched patients who had lived with this for years experience real relief within days of making these changes, not because they found a miracle, because they finally understood what was actually happening, and they stopped fighting their body and started supporting it. You don't have to clear your throat before every sentence. You don't have to wake up every morning with that heavy, frustrated feeling. You don't have to accept this as just the way things are now. At any age, your body retains a remarkable ability to return to balance when you give it what it needs. Start today. Start gently. And trust that when you begin to listen to your body with real attention, it will show you the way back to comfort.